the Eyesight Foundation, it is easy for us as grant makers to consider each program we support as a standalone project, judged through the lens of our stewardship role and grant-making terminology. How many serve, cost per incident, measurement, evaluation, impact, input, output, outcomes. And we need to scrutinize each project in this manner. We are stewards of the funds entrusted to us. But when we are analyzing the statistics, let's remember, behind each statistic is a real person with real vision problems. And even though we do evaluate each grant individually for impact and effectiveness, no single effort stands alone. There are many efforts that interlock to help shape eye care delivery in our community. To better understand how these pieces fit together to make a difference, let's look at our grant-making impact through the eyes of one child with vision impairment. This is Mary.
I was at school and they came and took a picture of my eyes.
Before anything else, first you have to identify that there is a problem. Since whatever vision a child has is normal to her, we can't rely on self-reporting. Vision screening is an important piece in this puzzle. Through various screening efforts around the state that may use different technology or target a different population, most school children are screened multiple times, beginning in daycare or kindergarten and continuing as a child gets older as their vision may change. These screenings are conducted by groups such as Focus First, Preschool Peepers, Alabama Lions, and Cahaba Valley Healthcare. But we recognize that it isn't enough to identify a problem, it needs to be addressed. And that's where Sight Savers America provides such a vital piece of this puzzle. Children who fail the vision screenings are entered into Sight Savers' case management system to ensure that each child gets the eye care they need.
They told my mom I needed to see the eye doctor.
Sight Savers works with a network of providers to schedule appointments for eye exams and also arranges transportation when needed through Kid One Transport.
I got to ride in the van because our car is broke. When I got to the eye hospital to see the doctor, I pushed all the buttons in the elevator.
Eye exams can be scheduled with doctors at UAB Ophthalmology and Optometry, at private practices, or at community outreach clinics such as the Wellness Center at United Cerebral Palsy, the Lovelady Center, the Jefferson County Health Department, and the Mobile County Health Department.
When I saw the doctor, he put drops in my eyes and shined a light in my eyes. He said I needed glasses. I said okay, but I want the pink and sparkly ones.
Frames and lenses are often provided at low or no cost to the patients.
The doctor told Mom I needed to go to the Low Vision Center to see Dr. DeCarlo. I pushed all the buttons that time too.
Children whose vision cannot be corrected with glasses are often referred for low vision rehabilitation to work with the vision they do have left. They try out assistive technology devices. They may receive orientation and mobility training so they can get around better with a cane. Older children may even be able to drive in spite of their vision impairment with special bioptic training.
They even gave me a CCTV so I could do my homework.
Sight Savers often provides CCTVs for children for home use. They deliver the device to the child's home, set it up, and train the child and her parents on how to use and care for the device.
When I got to school, I couldn't see the board, but now I can a little bit. One girl in my class, she reads Braille. The teacher helps her with that.
Through a program at the UAB School of Education, select teachers from across the state are certified to be teachers of the blind and visually impaired.
I have fun in class now. I like when we do Art Best. My teacher says I'm a busy kid.
These teachers are in high demand once certified. They take their specialized knowledge back into the public school system or sometimes are employed by nonprofits such as the Bell Center for Early Intervention.
My little brother has bad eyes too. He has a special teacher because he's so little.
Support groups help parents and kids cope with vision loss. They may teach parents how to understand their child's vision limitations, what the child's rights are under the Americans with Disabilities Act, how to advocate for those rights in the school, and how to foster independence in the child. Here, children have the opportunity to interact with other children with vision impairments. This is important to the child's self-esteem, to know they are not alone.
I went to camp with kids whose eyes didn't work good. One boy couldn't see at all, but he wasn't afraid of the horses. I was at first.
Recreational activities help set the groundwork for these kids to succeed in spite of their vision problems. These kids have been left behind so much. It is inspiring to see them blossom and gain confidence when they realize that they can climb a rock wall or ride a horse if given the right tools and encouragement.
Then I petted the horse. It was so soft. I got to ride it too. Then I climbed up the wall, and I wasn't even scared till I looked down. I like art class. I painted an angel. She has sparkly wings with glitter.
It is very rewarding for these children to participate in art programs and contests for students with vision impairments, and to have their art shown in galleries and traveling exhibitions across the state, and even sold to collectors. Many receive ribbons and cash prizes for their artwork.
Then Dr. Kogan told me I needed surgery to fix my eye. I was scared then too, but it didn't hurt, and I got to wear a pink eye patch.
Sometimes children need surgery to improve or save their eyesight. The surgeons at Callahan Eye Hospital provide life-altering services for their smallest patients, and in doing so help train the next generation of eye doctors. Meanwhile, researchers at UAB are studying pediatric vision impairment and disease, working towards improved vision for the eyes of tomorrow.
Dr. DiCarlo told me that one day they will even teach me to drive. I'll go real fast.
As we have shown, no one effort can meet all the needs of a child with blindness or low vision. It takes many agencies, programs, and providers, each contributing a piece of the puzzle. Their extraordinary work fits together to help create a continuum of care for children with vision impairment. Through the collective grant-making portfolio of the Eyesight Foundation and our funding partnership with the Community Foundation of Greater Birmingham, we are making a difference in the eyes of Mary and thousands of children like her in our community.